Kenya's correctional centers are turning out to be the new hotspot for coronavirus after 42 inmates at the Industrial Area Prison tested positive. The 42 remandees are said to have contracted the disease from 2 others who had been held in the cell with them. And as Jane Goin reports, the inmates were this evening admitted at the Kenyatta University Hospital for treatment, even as the country's caseload inches towards 2,000.
This remand prison with a population of 2,634 inmates as of today is now on the government radar as the number of those with coronavirus continues to soar. Barely 3 weeks ago, 2 remandees were confirmed to have contracted COVID-19, and 42 other prisoners who came into contact with them were immediately placed in quarantine. Saturday, the 42 tested positive, with more awaiting results. The remandees have since been moved to the Kenyatta University Hospital for treatment and booked in batches of 6 in the hospital wards. 16 warders deployed to the facility to guard them as fumigation commences at the Industrial Area Prison. It is, however, feared the number could be higher. Anticipating an outbreak in the prison facilities, which are highly populated and social distancing seemingly a mirage, the government had commenced a decongestion process where 7,000 petty offenders were released, reducing the number of inmates across the country's correctional facilities from 54,000 to 49,000. Separate housing units have been set up at various facilities as quarantine areas and also as holding rooms for recent offenders who are tested before they mingle with the others. Even as the spotlight shifts to prison facilities, the government is also maintaining a keen eye on informal settlements, which have over the past few weeks seen a spike in the number of infections.
We are trying to focus more on the informal settlements, where sometimes it's practically difficult to ensure physical and social distancing. So our message there is more of infection prevention control measures.
Saturday, 143 more people were confirmed to have contracted COVID-19, pushing the total cases to 1,888. The Ministry of Health projecting between 4,000 and 5,000 cases in August and between 160 to 180 deaths. And as the caseload increased, politicians preaching water and drinking wine were put on notice, with normalcy beginning to slowly creep in. A number have been seen defying government directives on maintaining social distancing and wearing of masks.
It is of crucial importance that we walk the talk. We must lead by example. It does not help if we continue to appeal to our people to wear masks in public places. Yet some of us as leaders do not do the same.
With increased testing contributing to the rise in the number of COVID-19 infections, the government's rallying call to Kenyans remains strict adherence to containment measures imposed so as to flatten the curve. Kenyatta University Hospital, Nairobi.